Hello guys, how are you all? My name is Dr. Sagar Chaudhary and I am a dental practice coach and speaker in India. And why I am here today? I am here today with an amazing lesson that completely changed my practice, that helped me to increase the number of patients. And by that I never meant that so many patients are coming into my practice. By that I simply meant that if 10 patients were coming into my practice and out of them 6 were convinced or 7 were convinced or 8 were convinced to get their treatment done, now all 10 of them are convinced. So what I learned? I learned the difference between conversation and consultation from Dr. Manish Chitnis. And this amazing learning I want to share with all of you, right? So I'm going to tell you the story, the learning with the help of this story. This story is very relatable. You will feel that you have felt it, you have experienced the story, right? So I'm going to pause that story in between and I'm going to give you two options. One option which I was following from last 6 years, which helped me to convince 6, 7 or 8 patients, and another option which I learned recently from few months back from Dr. Manish Chitnis, and that helped me to convince all 10 of them, right? So let me start the story. You can easily relate to it. The story is simple. The patient came to my clinic and he was adamant that I'll not come inside. I'll stuck onto the gate, but I'll not fill the form. I'll not give you any consultation charges. You have to tell me that what are your clinical charges, what are your consultation charges, what are your root canal charges, what are your extraction charges. Now I'm pausing the story and I'm going to give you the first option, which I was following and teaching also from some time. That would be that you have to fill the form, you have to give me the consultation charges because you can pay, right? If you cannot, if I can see that you are below poverty line, I can do that for free, everything. But I know that you can pay, so you have to pay. Then you can come inside, then you can talk to me, then I can give you every option. Or you can leave with a smile on my face. Obviously, I will not say that you can leave, but I'll say you have to pay me the consultation charges first, right? So this was my first option. This was something which I was following. Now the second option, which I learned recently. The second option will be that I'll ask the patient that are you in pain right now? The first question will be, can you please come here and sit in front of me? This will not be chargeable. You are not sitting on my dental chair, you are sitting in front of me. Can you please tell me, are you in pain right now? Because this is my first concern. If you are in pain, I am going to ask my assistant to give you painkiller and that person will give you the painkiller. If that person is in pain, my assistant will give the painkiller. And if he or she is not in pain, I'll ask then, what is your chief complaint? What is your problem? And vaguely I'll answer, all right. By talking to you, I can understand that this must be a problem, but to convince, but to be confirmed, I have to take you to my dental chair. There I can do the proper checkup. There I can see that what is the problem and what would be the treatment and what would be the charges. If needed, X-ray will be done and that would be chargeable. So the consultation X-ray will be chargeable. This is something which I am having as a conversation. And if you will go to my dental chair, that will be the consultation, complete consultation, right? And trust me guys, when I started that with a smile on my face, politely, with kindness, all 10 of them are being convinced. I'm sorry to say, but some of you will say that this is something which will not be helpful in India. But I want you guys to apply it. I know that you are frustrated and irritated, so please don't comment anything negative. Talk to me personally. I'll help you, right? So you must be you should ask, you can ask the question that what was the simple thing that changed the mind of the patient. A stubborn patient who was adamant that I'll not give you any penny of mine before you will tell me the charges. Now how can that patient be convinced to give me the consultation charges also and get the treatment also? Simple thing. When I ask the patient to sit down, I always say in my workshops also, the best marketing strategy is to care. He felt the care when I asked him that, do you need water or are you in pain right now? Firstly. Secondly, we are Indians, we are smart people, we are Asians, we are smart people. We need to feel that the money we will spend will be valuable to us. We should feel valued. When he was observing when he or she was sitting in front of me and when he took the painkiller and he was getting relaxed, he can feel the AC on his face, he can see the cleanliness in my clinic, he can see how obedient my staff is, he can see how clean my staff is, he can see how wonderfully dressed my staff is, he can see how beautiful ambience is, he can see the how good fragrances, he can feel that I'll be valued here. So he felt the care, he felt the value. These are the two things which patient need to be felt, then only he'll spend the money or invest in you to take care of you, of himself or herself. Right? So these are the few points which you have to consider. As I said, that please don't post any negative comments. Even if you want to, I'm not going to answer that. If you're following my videos, you can see I don't. I personally message people that if you want to discuss about this, please do discuss. But there is no point of wasting time on Facebook and tark vitark karne ka koi fayda nahi. Right? So thank you so much, guys, for so much of love for listening to me, and thank you so much for such amazing response on my YouTube channel, Dr. Sagar Chaudhary. Keep subscribing and keep liking my page, Sarcastic Shugi. Keep following us on Twitter and Instagram by the name of Dr. Sagar Chaudhary. Amazing response on my workshop also. I think triple time more delegates are coming from last workshop, and people are coming from all over. I can feel the love from all over. I'm highly grateful. People are coming from Northeast, from Assam, from Mumbai, from Bengal. I thought that people will come from Delhi itself because it is happening in Delhi. So thank you so much, guys, for such amazing response on my workshop. I can feel that you are committed. There is a difference between interested and committed. You are not only interested in dentistry, you are committed to do dentistry in India. And the goal is, as I always say, to build a team, family of young enthusiastic dentists who can believe in themselves and in the country and in the dentistry in India. Thank you so much, guys, for so much of love. Thank you so much for listening to me. I love you all. Summarizing again, patient have to feel the care, patient have to feel the value, and that will happen when you will be a little kind, because this is important in our profession and in life. Thank you so much, guys. Have a wonderful practice and wonderful day. Thank you.